Hey guys, hope you're doing well. Today I'm gonna make a video on the anatomy of heart using the models. So first of all, coming towards the orientation and the position of the heart, and it is present in the thorax, in the middle mediastinum between the lungs and just above the diaphragm. The level is T5 to T8. The vertebral level of the heart is T5 to T8. This is the apex of the heart. Apex is pointing leftward, upward, and forward, and the base is pointing opposite. It's pointing toward the shoulder, backward, and downward. Now, coming towards the gross anatomy, this is the model where we have removed the pericardium. Actually, maybe we have removed the fibrous and the parietal layer of the serous pericardium, and maybe the visceral is here because the visceral pericardium is transparent and it's sticky to the heart. Okay, so first of all, coming to the sulci, we have three major sulcus in the heart. Coronary sulcus. Okay, this is the anterior side of the coronary sulcus, and posteriorly it will go like this, and you can see it will actually separate the atria from ventricles. The second one is the anterior interventricular sulcus, and this will actually separate the two ventricles. And on the posterior side, this one is posterior interventricular sulcus, and it will separate the two ventricles just like the anterior one. And the coronary arteries majorly pass through these sulci. Now coming towards the chambers, you can see clearly the above portion are the atria and the below are the ventricles. This is left side and this is the right side. So this is left atrium, this is right atrium, this is left ventricle, and this is right ventricle. Now just clarifying the concept of the auricles. Auricles actually the muscular pouches attached to the atrium, and here it is very prominent. These will help in pushing the blood, and these will increase the volume of the atrium. Coming to the right atrium, if we remove this portion, we will explore the right atrium, and it has 6 distinct walls. This is the superior wall of the atrium because it lies above, and you can see the superior vena cava will drain here. This is the medial wall of the atrium, and this is actually the interatrial septum. You can see this is the septum between the two atria. This portion is the anterior wall, and this portion you can see this is the lateral wall. And the anterior and lateral, they both have the pectinate muscle that will help in pushing the blood into the ventricle. Then we have the posterior. This you can see this on the posterior side. So the posterior wall has the opening for inferior vena cava, and the inferior wall has the tricuspid wall or the atrioventricular orifice where the blood will move from the atrium to ventricle like this. This is the inferior wall. This fossa is called fossa ovalis or oval fossa, and actually in the embryonic stage the blood used to be moved from the right atrium to left atrium directly without going to the lungs because there is no need of oxygenation, because the in the embryonic stage oxygen is taken from placenta directly. So the blood used to be shunted directly or bypassed directly from the right atrium to left atrium through this fossa. In the embryonic stage, it is actually a hole, an opening, but right now it's a fossa. There is another opening called the coronary sinus, not shown in this model properly, and the heart uses that opening to drain all the blood from itself, or simply all the cardiac veins are drained into the coronary sinus. Now coming to this portion, which is ventricle, actually the right ventricle. If we remove the anterior side, so this is the inner look of the right ventricle. This is the right ventricle, and it's actually triangular. You can see this is triangular. The atrioventricular orifice here, and the orifice is guarded by the wall that is called tricuspid wall, called so because it has three cusps. Some tendinous structures called cordia tendinea, like this one. These are the cordia tendinea, and these are attached to these muscles. These are called capillary muscles. The cordia tendinea is attached to papillary muscles on one side and the cusp of the tricuspid wall on the other side, and these will hold the cusp of tricuspid wall. Actually, when this ventricle will squeeze, So it will also apply pressure on the wall. So there is a possibility that blood will regurgitate into the atrium instead of the pulmonary trunk. The cordia tendineae and the papillary muscle actually help to prevent this situation, to prevent the regurgitation actually. Now, if we remove this structure and we can see the inner side, it's actually a very rough appearance. There's like a muscular network that gives the rough appearance, and that is actually called the trabecula carnea. The blood will be moved from atrium to ventricle, and when the ventricle squeezes, it will push the blood into the pulmonary trunk to take it to the lungs for oxygenation. The wall here, which is guarding this trunk, it is called pulmonary wall, and it will be present here actually just like this. The wall will be just like this, having three cusps, but present here, and this will be called pulmonary trunk. Sorry, this will be called pulmonary wall. The pulmonary arteries will carry the blood to the lungs for oxygenation, and after oxygenation, the blood will be carried back to the left atrium through pulmonary veins. Actually, all arteries will carry oxygenated blood in the body, and the veins will carry deoxygenated blood. But the exception is pulmonary artery and pulmonary vein, because the pulmonary artery will carry deoxygenated blood, and the pulmonary vein will carry oxygenated blood. When the blood is carried here to the left atrium, it will be pushed into the left ventricle through this orifice. This is also the atrioventricular orifice, but on the left side. And this orifice will be guarded by a wall called mitral or bicuspid wall. And this is the only wall in the heart that has two cusps. The left ventricle is more muscular and larger than the right one because it has to overcome more resistance because it has to push the blood into the whole body. So this is a little larger and muscular. From the left ventricle, the blood will be pushed into the whole body through aorta, and the orifice here is called aortic orifice, and the wall here is called aortic valve, actually this one. From there, the aorta will carry the blood to the whole body. This is actually ascending aorta, this is arc of aorta, and this is descending aorta. And finally, coming towards the blood supply of the heart itself, the arteries are called coronary arteries. Two branches will come from the aorta called the right coronary artery and left coronary artery. These are the two branches. This one is right coronary artery and this is left coronary artery. The right coronary artery will be a little larger, but the left coronary artery will immediately split into two. So this one is small. First, coming toward the right coronary artery, it will give two branches, right marginal artery or acute marginal artery. Okay, because it is on the margin of the heart on the right side, so this is called right marginal artery, and it is called acute because the angle here is less than 90, so it is called acute marginal artery. The second artery is posterior interventricular artery. This is called posterior interventricular artery. A minor branch will go from here, not shown in this model, but it will go to the SA node, and this branch is called the SA nodal artery. And one branch from the posterior interventricular artery, it will go to the AV node. This will supply AV node, and this is called AV nodal artery. It will actually go from here. In total, the right coronary artery will supply SA node, AV node, and the right atrium and right ventricle. Now coming to the left coronary artery, the trunk is very small actually, and it will be immediately divided into the branches. The first one is the anterior interventricular artery, or it is also called LAD, the left anterior descending artery. And this is the major artery, and 40% of the myocardial infarctions or the heart attacks are caused by the blockage of this artery actually. The second branch is the circumflex artery, this one that will move around to the posterior side. And there is a branch from the circumflex artery that is called the left marginal artery or oblique marginal artery. And here the angle is actually greater than 90. Another thing is the anterior interventricular artery and the posterior interventricular artery. These will innermost here at the apex of the heart. In 70% of the population, the arrangement will be like this, that the posterior interventricular artery will be formed by the right coronary artery, but in 30% of the population it may be formed from the left coronary artery. This artery may be formed from the left coronary artery in 30% population, and in that case it is called left dominant artery. So just clarifying the concept of the right dominant heart and the left dominant heart. If the posterior interventricular artery is formed by the right coronary artery, that is called right dominant heart, and that is very common. But in some cases it may be formed, this posterior interventricular artery may be formed from the from the left coronary artery. In that case it is called left dominant heart. Ending this video on why these arteries are called coronary arteries, because these makes a crown around the heart. Hey guys, so this is the end of the heart anatomy part 3. Kindly like, subscribe and share, and please tell me in the comment box, should I use these models to make more anatomy videos or not. Thank you very much.